Hi, Ministers. Junsen from Today here. My question is, what are you hoping to glean out from these pilot vaccination programs? And what are the things that are still quite unknown about vaccinating a population that you hope to actually learn? And whether this vaccination program is a two-dose kind of a vaccination program, you're hoping to roll it out to the 10,000 people, two doses rather than just one dose. And a second related note is, I noted in the press release that it said 39 NCID staff have completed two doses. My understanding is that there were 40 who went through the first round of vaccination. So what happened?
Maybe I ask DMS to respond to the issue on the vaccinated numbers.
Well, I'm going to answer both your questions. I'll start first with the pilots. The purpose of the pilots is to make sure that the processes we put in place are robust enough that when we now start dealing with a larger group of people coming to the vaccination center to be vaccinated, that this will be a smooth, efficient process, but also at the same time a safe process for all that come forward for vaccination. Each site where we set up a vaccination facility has its own unique challenges because the location is a bit different. We started out with vaccination facilities in our hospitals, and in the hospitals there were ready facilities that we could use to provide safe care. And there was a lot of staff that were present. We also performed vaccinations at our polyclinics that required a different set of design of the facilities, given that the space constraints within the polyclinic were very different compared to in the hospitals. And as we set up the vaccination centers, this required us to design the placement and location of the stations to maximize the use of space, to accommodate a larger group of people coming in, but at the same time to make sure that the vaccinations were safe. Now we're talking about pilots where we want to bring seniors coming into the vaccination centers, and seniors will have their own challenges. Some may have mobility issues, others may have other concurrent medical conditions that require a lot more attention to be paid to ensure that we can observe them safely and have them looked after properly within the vaccination centers. And that requires us then to work out those processes through these two pilots. Once we are confident that the processes are tweaked and are optimized, and we are confident that we can look after our seniors properly, we are then going to roll this out, opening up new centers, scaling up the capacity for vaccinations with each center, and then increase the throughput for vaccination for seniors in all the centers that we set up. So that explains why we still need to carry out several other pilots as we open up for a new group of our population that is to be vaccinated. You're right that we started out with about 40 healthcare workers being vaccinated. We have recommended that they should have their vaccination, the second dose of vaccinations 21 days later, but it's not always possible for individuals to come in and have that done exactly and on that same day. For a variety of different reasons. Some people may be working at that point in time, and therefore when we actually had the original cohort of staff that came from NCID having their vaccinations, it turned out that we had 39 being vaccinated on that first day. But I'm quite optimistic that the remaining healthcare worker will eventually also get vaccinated. It's just a matter of scheduling. And the difference in dates does not lead to any significant impact in the benefit of vaccination for the healthcare staff. It's a scheduling issue, and it's also when they're available to come forward to get that second dose done.
Thank you. I should just add that one of the purpose of the pilot is also to ensure that, because the target group for the first batch are the seniors, and we will also need to test our messaging, our explanation, our outreach to make sure that we are able to reach out to them. As I mentioned, I think during the previous press conference, that seniors is a very challenging group for us because many of them are staying at home. They don't come out because of the COVID-19 situation. So it's not so easy to reach out to them. And this is one of the areas that we want to also pilot in conjunction with the People's Association, how we can effectively reach out to this group of seniors to explain to them the process and to help them go through the process. The lessons that we learn from this pilot will then be implemented in subsequent vaccination efforts that we roll out. So this way, for the subsequent batches of seniors, it will be a much easier and more simpler process for them. That has been tested, and will give us more confidence in rolling out the programs in a larger scale for the seniors in time to come.